also the three amazing speakers that we have to present on this topic. I really recommend that you read their bios. I'll talk about them briefly, but they are an amazing women singly, and when you put them together, it's a force to be reckoned with. These women have very, very impressive histories in terms of being on the ground, addressing issues that are incredibly important, challenging issues, and not backing down. Their biographies are very, very impressive, but really, if you knew them and were aware of their depth, what's really impressive is their spirit, the reason they do what they do, their courage to address issues like sexual and gender-based violence that is an evil that is difficult to fathom, and their resolve to not back down. This topic is not for wimps, and these women are anything but that. They're Micah 6:8 women. They're walking justly, seeking justly, loving mercy, and walking humbly with their God. They've come also a long way. I think Yvette's come the longest from Democratic Republic of Congo, where she's serving as the project manager for the Women in Leadership program with IMA World Health. And Yvette, I got to know her yesterday. She is a mother and a caring, incredible person that really is tuned in to the hurt that this topic causes, but also sees the answers in building leaders, building girls and women as leaders. She has worked for IMA World Health for 19 years and with Sanru, and I know they value her very, very much. And please do read her bio as well. And we're so pleased to have Michele Moloney-Kitts. She didn't have to come quite as far, but she's a very, very busy woman, has taken on the leadership of Together for Girls, which is an amazing organization that is taking this topic of SGBV by the horns and wrestling with it. And she'll speak a bit more about her work, but she has an amazing background, has served with USAID. She was the deputy director at PEPFAR. That's when I think I met you, Michele, and has an illustrious career of service. And we're so thankful to have you here. And last of all, Jacqui Patterson, who flew up from Florida just for this conference, and we so appreciate that, Jacqui. Jacqui, too, is an incredibly busy woman and is currently serving as the Director of Environmental and Climate Justice at the NAACP, and making some impressive waves there. We don't want tsunamis, but thank you for all that you're doing for our planet and our people on this earth. But Jacqui has really been involved in so very many challenging issues and is a warrior. She is, brave, courageous, and bold. These are super women, and I'm so very privileged to invite them to come and speak. We are going to start with Jacqui's presentation. And then I'd like to invite everyone else to come up. And we're going to have the three presentations following one another, and then there will be a time for questions and discussion, and we really want to hear from you and what you would like to know more about from these incredible resourcing women. Thank you.
Okay, so good morning, everyone. Okay, good. So I'm just going to give you a bit of an overview of the issues that my other panelists are going to go into much more depth on. So I'll start with a few kind of stories to ground us in the realities of the women that we're seeking to advocate for as we address this issue of gender-based violence. So like I said, I'll start with 4 stories. First, Babita, who is in Nepal, And just again, really wanting to, we have a kind of in the world of HIV and AIDS and other places, we have this principle about nothing about us without us. We want to make sure that people who we're advocating for are in the room, their actual voices, their actual words. So I wanted to read to you some of the comments that Babita made as it relates to her experience with the intersection of gender-based violence and HIV particularly. So so these are just some of the words. He would beat me to the point that he was too ashamed to take me to the doctor. He forced me to have sex with him and beat me if I refused. Even when he was HIV positive, he still wanted sex and he refused to use a condom. He used to force me to have sex with him. He would beat me and slap me when I refused. He never used a condom with him. When I got pregnant, I went for a medical checkup. When I gave birth and the child had passed away, they told me I was HIV positive. I cried. The doctor told me, wipe your tears, the whole world is sick. And then, And then I also, as Laura said, I do work on climate change now and environmental justice, and we see a lot of intersections in terms of environmental and climate justice and the issue of sexual and gender-based violence. What happens is that climate change ends up being a threat multiplier for a number of the issues that we'll be talking about later that drives sexual and gender-based violence. And so in this case, we have a situation in Cameroon. Whoops, actually I need to go back. I wonder if that's even an option. No. Probably not. So you can look at this picture and think back to the one you saw before. So in Cameroon, where there is a woman who actually, because she was the person who was responsible for putting bread on the table and so forth, and with climate change, one of the impacts, as per that picture, is the scorching of the earth in terms of us not in terms of the droughts that we're seeing in the U.S. and droughts we're seeing worldwide. And when you're responsible for bringing that food to the table, then that actually changes your life. So this person, Susan, had to leave her home in Cameroon to travel to be able to make revenue for her family to another country. And in that travel, the border crossing, she actually ended up being sexually assaulted. And this is a place we'll talk about more where you'll see a lot of the sexual and gender-based violence that happens is at border crossings. She was sexually assaulted and she actually ended up being HIV positive as a result. So that's just another of the stories. We also talk about the intersection of conflict and sexual and gender-based violence, because you hear that often women are used as weapons of war. And Famata from Liberia, these are just some of the statistics around what happened with, some of the information around what happened with Famata. During the 2002-2003 civil crises, Famata was gang raped by a general and his bodyguard. She reported the rape to her father and he felt powerless to help. A few years after the rape, she began to feel ill. She was suffering from chronic diarrhea. She was pregnant, and when she visited the hospital, she was diagnosed as HIV positive. Her partner abandoned her and her twin sons. Famata believes that she acquired HIV and AIDS as a result of the rape. So, and this is actually another situation with HIV, and I should also give a disclaimer in that a lot of the work that I did do when I was with IMA World Health, actually, and otherwise, and Action Aid International was around the intersection of sexual and gender-based violence and HIV, so that's where you see a lot of these examples coming from that context. Joyce is right here in the United States. She was 52 years old at the time, and this was interesting because a lot of people think of acquisition of HIV, and also sexual and gender-based violence is something that happens to people who are younger, but she was 52 years old. She went out jogging one day, and at one point she encountered some folks on the jogging path, and then she felt like they were paying special attention to her, but she didn't really think much of it, and she went back home. Later on, someone knocked at her door. She opened the door, and because the person was wearing a police uniform, and the person came in and actually raped her in her home. And she became HIV positive as a result. So again, just some of the stories in terms of the context, whether you're in a war situation, whether you're just trying to put food on your table, or whether you're just going out for physical fitness to jog, these are all the different places that women are susceptible to experiencing sexual and gender-based violence. So I want to also just set the context a little bit in terms of some of the statistics, and my colleagues will go into a bit more. So a multi-country study by the World Health Organization found that 59% of women in Ethiopia, 50% of women in Bangladesh reported sexual violence by an intimate partner. A multi-site survey by the International Center for research on women found that almost 40% of women in India interviewed reported physical violence, 26% reported severe physical abuse, and so forth. In Kenya, a demographic health survey showed 68% of women agreed that a husband would be justified in beating his wife, including if he refused to have sex, and so forth. So just some of those statistics. And then we want to talk a little bit about the underlying social determinants. And these include patriarchy, sexism, racism, and xenophobia, and really unequal distribution of resources. So, and a lot of people would kind of just put capitalism there, but I don't want to give a socialist talk today. But that's a whole nother presentation. So we really want to keep those in mind, because a lot of times we talk about interventions, whether it's making sure that we're doing screening in hospitals or these various interventions. But until we really deal with these deep underlying social determinants, we're only going to be making so much progress in addressing this issue. So I just want us to keep that in mind as we go forward. So other kind of exacerbating factors: community and societal attitudes condoning violence against women and girls, lack of access to quality, appropriate health-related messages and services, lack of female control prevention methods, harmful traditional practices and norms, and homophobia has been an issue as well in terms of sexual violence against women and men, actually. So these are some of the high-risk settings and circumstances that we saw before: marriage and intimate partner relationships themselves, just going to school or being in a school setting and being in those kind of differential power relationships, immigration, as I gave the example, trafficking and coerced labor. I think some of my colleagues will talk a little bit more about that. Commercial sex work, people having disabilities are often vulnerable and experience a higher rate of sexual and gender-based violence. Humanitarian crises situations, whether it's conflict or disaster. We saw whether it's the earthquake in Gujarat, the earthquake in Haiti, the tsunami, time and time again, a spike in sexual and gender and violence in general during disaster situations, which is another place of intersectionality with the work that I do around climate change, given the increase in frequency and severity of extreme weather events that results from climate change, as we saw just right here a couple days ago. Food and water insecurity, as I gave that example before. Immigration twice, it's a big issue. And then, like I said, climate change and its myriad impacts. So I just want to talk a little bit about the role of the church, both positive and questionable in some cases. I did a multi-country study when I was with ActionAid, where we went out and we spoke with church leaders in different places. And these were some of the comments that people made, or some of the interventions that people shared. They talked about Mother's and Father's Day sermons that focused on relationships between husbands, wives, fiancés, and how there should be respect and love for one another. They talked about the messages they deliver about husbands, love your wives, wives, respect your husbands. A little bit of disparity there. And the one person said, as a pastor and counselor, I go and say to the husband, according to the Bible, you can't beat on your wife. You can't love something and try to destroy it. You have to stop doing this thing. Usually, as a pastor, he said, and a respected person, I get a good result. Another person said, someone tried to be violent against his wife. The church stepped in and suspended him indefinitely from membership. He was a church leader. They took decisive action to discourage such behavior among members. And then on the other side, we have some other types of comments that are, that give a sense of some of the negative roles that some of the churches play in this, or some of the church leaders. If you want to punish her, what you need to do is ignore her, was what one leader said. I tell the men, you can't abuse women in front of children or in public, was what another person said. When women or couples come to me with a problem with violence, I tell them the most important thing is you have to give it time. Give time a chance. Sometimes if you do not give time a chance, you end up concluding and pushing and use the wrong solution. As a result, you end up endangering the case and the relationship falls apart. So I say, I've heard the case, let us pray over it and then come back together. Counseling is a psychological thing. So again, like the other two are very troubling. The last one is just kind of somehow benignly, it's just not enough really. So there's just kind of this continuum around overt kind of bad messaging and then just not enough in terms of real positive transformative messaging. So some of the positive roles that we see churches playing moving forward, and then again my colleagues will go into a lot more depth than I. Just the work around humanitarian assistance and being sensitive in that. Some of the direct ways that people are involved on this kind of field side, on your left side, there's a situation where people are actually dealing with the impacts of climate change in terms of dealing with the land in a way that helps to address some of the climate change issues. On the upper right hand, you'll see a woman who was actually given literacy lessons and started her own business dealing with grains and so forth. On the bottom, a woman after the Haiti situation had her home rebuilt because housing is a big issue that's intersectional with gender-based violence. And then schooling for girls is critically important. So this is a little bit around schooling, and then also a bit more around kind of helping people with their food security issues. So again, my colleagues will go a lot more into these, but I'm just giving you a bit of an overview to kind of prime you for my colleagues. And another role of the church is very important is really being involved in advocacy, being a voice of advocacy around policy, so we have some macro level changes that contextualize these issues. And then when necessary, taking it to the streets. This was in January of this year. The Interfaith Moral Action on Climate Change, which is a group that I'm a part of, was right in front of the White House with our kind of demands that the White House do a lot more on climate change, go beyond rhetoric and go into some serious action, particularly given the number of places that there's intersection with gender-based violence and other issues. So. And this is just ending us on who we're really trying to protect and uplift, the girls in Haiti, and this photo is courtesy of Women Thrive Worldwide. So that is the end. So thank you.
Okay. Oh, sorry. Okay, wait a second. Here I am. Good morning, everyone. I'm now going to kind of take this conversation to the next level, and I just want to preface this with something that I think we all have to really acknowledge, that first of all, gender-based violence, physical, emotional, and sexual violence against women, children, and boys is in fact a global epidemic. If this was an infectious disease, we would have teams from WHO flying around the world. There would be global conferences on a regular basis, and we would be really trying to address this as a global problem. Instead, this issue is shrouded in stigma and silence, and there's a lack of data, and we're not talking about it. So one of the reasons why I'm so thrilled to be here is that the faith community has the largest access to the widest population on the planet. And I really hope that together we can start to lift the veil that is shrouding these issues. It's really, really important. Linked to that is the fact that we really do have to acknowledge that we're in a new space. What is it that accelerates equality in relationships? What is it that really kind of perpetuates rather this whole issue of gender-based violence and these power inequalities that are really driving this issue? And one of the things that we're doing at Together for Girls is that we're really trying to, and what I hope you'll leave with today is an understanding that in fact the issues that were being described here are issues that actually start even antenatally. And that one of the things that we're learning about is the brain development of children and their resilience. And everybody always says that kids are incredibly resilient. You can put them in any situation and they recover like that. And in fact, what our data is showing is that that is really not the case. And that kids who suffer a lot of stress actually have very different brain development than those that don't. And the experience of violence is one that is extraordinarily stressful to children. And just one quick data point, there's a study out of Rwanda that showed, looking at DHS data, that girls who witnessed their parents being physically abusive with each other as children were 2 times more likely to be HIV positive as adults. And there's a whole reason of why that happens. And it's not just the actual moment of rape where HIV is transmitted. It is the experience of violence that does huge damage to brain development. It inhibits people's ability to respond to stress, and it sets you up for a whole series of kind of behaviors that are very risky later in life. So the other thing that I want to make sure that we all realize when we're talking about this here is that this is not a problem that is unique to one country or another. This is in fact a global problem. And these are headlines from within the last 6 months, okay? So this is not new stuff. We have child marriage as a really endemic problem where in fact communities, governments, and churches are actually endorsing the marriage of 14 and 15 and 16-year-old girls, which is actually just authorized rape, let's face it. We've heard stories about India and what's happening there. We all know the situation in South Africa. Who can tell me what is the largest number of new infections? What population do they come from in South Africa or Southern Africa? Does anybody know? Young girls. It's not just adolescents, it's young girls. And then the other areas right here in the US, I think we all witnessed who live here, the story at Steubenville. We've seen the whole stories of problems within the Catholic Church and other churches. We've seen the problems with coaches and authority figures, and there is just something about this dynamic with authority figures that is really, really challenging. And then I would say, just so that you know, one of the riskiest things for a young woman in America is to be an undergraduate at college. Okay, 1 in 4 undergraduate girls will have some experience related to rape during her undergraduate experience. And it's something that I'm really thrilled to say that girls in America are really starting to try to take charge of, and we're working with them on a whole host of tools for prevention. So I want to just talk a little bit about Together for Girls very briefly. And this gives you a good example of why we were formed. So when many of us started as, probably with the feminist movement and then on to reproductive health and then on to HIV, and now, of course, this is the issue of the day. So when I was working at PEPFAR, one of the things we really wanted to do was to set up post-rape care services, because in all honesty, and let's be clear about this, if there could be one message I would like people to remember, is that if you encounter a woman who's been raped, if she gets care within 72 hours, she can access life-saving ARVs and does not have to end up being HIV positive. And so one of the things we wanted to do was to see, okay, if we introduce comprehensive post-rape care in a couple of clinics, what would happen? Would we be able to increase access to services? So we did a pilot in about, I think it was probably in the end, our total was, our N is over 500. We had about 20 clinics, 10 in Rwanda, 10 in Uganda, and we did the whole thing. Set up trained healthcare workers, trained community workers, trained police, and what does it need to really set up comprehensive post-rape care centers in a community health center? Well, I tell you, like all these things, we had an extraordinarily unexpected finding, and that was who presented for care. So, of course, we expected, and services are designed for women of reproductive age. But as you can see from this picture, that is not who presented for care, okay? So we have a cohort of 0 to 5-year-olds, and then, unfortunately, we didn't know this, which is often the case in research. We should have never had a 16 to 20-year-old grouping. It should have been broken out a little bit differently. But the bottom line is, what's wrong with this picture? Children are who are presenting for care when you set up post-rape care services, and services are in no way set up to provide post-rape care for kids. And then the other thing that's wrong with this picture is, where are the women? And we know that these women are also being raped. And I've talked to many, many of my sisters, and they tell me the reason why, and this is totally anecdotal now, is because by the time they're 22 or older, they've been raped often enough, usually 2 or 3 times, so they just don't even bother anymore. It becomes a norm. So as a result of this, we put together a private-public partnership that brings together 5 UN agencies, the US government, and the private sector to really deal with this issue of, originally we were very focused on sexual violence in girls. And now what we're realizing, because of the data that we're getting out, is that in fact, it's not just sexual violence that's the problem. It's broader violence. Emotional and physical violence is very important to address as well. And that, in fact, while girls do absolutely remain much more vulnerable and are much harder to reach in terms of programs, so a focus on girls is very appropriate, boys are not immune. And many boys are affected as well with similar consequences. And I will say that when you look at the whole issue of perpetration, what you find now, and we have good new data coming out on this, is first of all, not every boy that experiences sexual abuse or abuse as a child is going to grow up and perpetrate. But if you do experience that, you are much more likely to end up perpetrating. And also we know now from some data coming out of Asia that perpetration, often first perpetration occurs before the age of 18. So again, who are we targeting and what is our messages? These are things that are important. So we have 3 pillars of kind of action in our partnership. The first is that we collect, oh, thank you very much. We collect, we have a nationwide household survey on emotional, physical, and sexual violence against girls and boys that was actually designed and invented at CDC in Atlanta. And we usually partner with governments, UNICEF, and CDC, and we underdo this survey. And this survey provides us with really data that people have never seen before. And when governments look at this, so far our response has been absolutely phenomenal, and it's really served as the driver for a national coordinated response on addressing these issues. And then the last is we're, of course, very interested in global advocacy and public awareness. So I only have 10 minutes, and I have a plethora of data slides. So I'm just going to fly through these just so that you can get a sense of the data. You can go to our website. I think this presentation is even available or will be, and take a look at it further. So this is, so far we have data that we can use from 5 countries, but we're working now probably in another 10. The first survey we did was in Swaziland, and in Swaziland we only interviewed girls. It was kind of like getting our feet wet, and then we realized, oh no, that's a big problem. We got to talk to girls and boys. So this is basically an incident slide. In other words, it's looking at what happened in the last year from 13 to 17-year-olds. And so you can see the percentage that experienced any violent sexual experience in the last 12 months. And it's not inconsequential. This is probably a little bit more important. This breaks out, we interview people about 4 different kinds of sexual violence. With forced intercourse, coerced intercourse, attempted unwanted intercourse, and unwanted sexual touching. So we're able to actually kind of get a pretty good sense of what's going on. What you see here are really pretty high levels of sexual violence. This slide, I think, is a real eye-opener and incredibly important. So these are the number of girls and boys who reported that their first sexual experience was unwanted. Okay? So we're talking about 1 in 4, just about, say that they did not want to have sex the first time they had sex. And so that's very important and something that I think we really need to be thinking about. Other things that we're getting are more data that will help us inform programs. This is data specifically from Tanzania, but we have similar data now from other countries, and I can tell you it's not dissimilar. So where is sexual violence happening? It is happening in the home, okay? It is not necessarily happening out there. It's happening in communities, in neighborhoods, in the home. I will say that we've all experienced a lot about schools being very dangerous places for girls, and I think that remains true. And especially if you combine school together with going back and forth to school. And as we know, often one of the barriers for children to go to school is that their parents are worried about the dangers of them getting there. And those are very legitimate fears. A little bit on perpetration, and again, this is just from Tanzania, but it's not dissimilar to others. What we're finding is that perpetrators, this idea of stranger rape is actually the exception, not the norm. I mean, it does happen, but often this is happening with people who you know and with authority figures. The other thing that we're trying to get a better handle on is what portion of this would be considered peer and dating violence versus what portion of this is kind of more, partners who are far, way older, kind of the sugar daddy issue. Two slides I didn't include here, but I love to talk about. One is that you cannot imagine the levels of physical violence that these children are also exposed to. So in Tanzania, for example, and in Kenya, both girls and boys report, and in Haiti, over 70% of them have experienced a severe beating at least once in their lives. So what we're doing here and what's happening here is that basically, of course, conflict is a terrible area, and the violence and rape as a weapon of war is a really horrible thing. But the reality is that there is kind of an environment or a culture where violence is almost a norm, where corporal punishment is legal in schools, where parents feel as though it's really fine to really beat your child, or authority figures do, or there's a lot of, as we've seen in the data, gender-based violence where yes, a woman does think it's perfectly fine for my husband to beat me if, I've burned my dinner. So, and we have found that most of the sexual violence, there's strong overlaps with physical violence as well. This is a really important slide because what it gets to is that people are not disclosing, okay? And we all know how healing it can be to disclose a terrible experience. So they don't have a safe space to do it. They're not telling anyone. This is even your best friend, your sister. Less than 50% of girls are disclosing to anybody. And I find this to be true here in the US as well. These are very difficult issues and we don't make it safe. And then, of course, who gets services, as you can see, the pyramid goes down and down. So the one thing that I always feel very important in these talks is that people hear this data and they kind of get paralyzed. Like, oh my goodness, this is an absolutely overwhelming problem and one that we can do nothing about. And I want to say right here and right now, that's absolutely not true. We have evidence-based solutions. There are things that can be done, and we know how to bring them to scale. So one of the biggest challenges is how do you really garner and manage a comprehensive multi-sector response. And we do have models and ways of doing that where we have basically child protection committees, we engage communities, we know that we can teach children their rights so they know that this isn't right. We can do many things like that. And I have, Together for Girls has a technical framework on our website that really outlines what are some of the actions that are evidence-based and proven to work. Tanzania, I've run out of time, so I'm going to go quickly. Tanzania has really taken the lead in a very extraordinary way. They have costed action plans now that go across sectors. They engage communities. They have actually accountability frameworks, and they're getting their ministries of finance to start paying for things. And then, most importantly, how can the faith community help? So first of all, evidence-based, okay? There is data, we know what we can do, and we have to make sure that we have the facts and we're using them appropriately. I think you can stop the silence and start speaking out about this issue. And as we know, the faith community can be a huge resource, but also, as has been noted in our previous slide, and as we all know, in some cases it also can be a hindrance. There's an amazing organization called We Will Speak Out that is a faith organization that's totally dedicated to this issue, has amazing things. One of the things is supporting children, knowing their rights and protecting themselves, supporting survivors. The whole question of re-entry into society is a big one, and how you can make children and women feel that this isn't their fault. You know, they're not the bad people, and we know a lot about that. And then there is some really interesting work happening on pastoral training about how to really start to shift these norms towards equality. Of course, we want to see this on the global agenda. We want it to be at the level of, you know, some of the infectious disease discussions that are taking place. And we know that the impact on the well-being of communities is huge. So with that, I thank you.
Oh, good. Julia's fix it, I think. Yeah. Okay.
Yeah, thank you. I think that it is for me an immense honor to stand before this August Assembly to share with you the experiences of Ushindi projects in Eastern of Congo. The presentation I'm going to share with you is on the same time a success story highlighting the success of IMA World Health Ushindi with holistic and positive approaches for overcoming sexual violence and empowering women in DRC. But also, this presentation is a dark and moving story which revealing in the country where the sex has become a weapon of war, a weapon of humiliating, and the weapon of hurting, condemning women and children into death and poverty. As the title is Holistic and Positive Approaches for Overcoming Sexual Violence and Empowering Women in Eastern DRC Congo. This is the story of Safi, 4 years old, mother of 7 daughters in Kitutu area, was hunting vegetables and firewood outside her village when raped by 5 rebels. Her husband was killed when come to research for her. Kabibi, 20-year-old, with her one daughter firstborn, she was raped in front of her husband by a group of rebels, taken in the forest. 1 year late, when escaped, she was pregnant of 7 months. It wasn't easy for her to accept that reality. This is the context within which IMA World Health and its partner operate every day, and the story of Ushindi and how it is helping to overcome the daily horror of sexual and gender discrimination in Eastern DRC Congo. A small overview about our country. DR Congo is a large country in Central Africa. It's got 11 provinces with a population estimated 70 million, and its population still young. 15% of population still young, and 70% of the population are living in rural area. 6.3 children per woman, and 70% of the population are poor and living less $1 a day. That is okay. Women form a majority of the population, and their status remains low, caused by structural discrimination and by traditional customs and laws. Women and girls become pregnant as a result of rape and may become infected with HIV, altering their features. We have a high rate of maternal mortality, and low prevalence of contraceptive. Women and girls abducted by militia and rebel groups are forced to become wives and fighters. They are also subjected to sexual violence and stigmatized as child mother. IMA World Health, Ushindi, we overcome sexual and gender-based violence in Eastern DR Congo from 2010 to 2011, gives holistic response through 4 approaches as indicated by the logo. 4 strengthened, intertwined hands, psychosocial, medical, legal, and economic. We have 4, the project have 4 compounds implemented on 10 health zones, 108 health centers, and 1 million people as beneficiaries. And the project is implemented by three implementing partners. They are FBOs, faith-based local organization, is PPESP, IL Africa, and Hospital Panzi. And that all activities are supported by 4 technical partners. We have Save the Children, we have Children's Voice, ABA, and Care International. For the 4 intervention, the main 4 intervention holistic approaches, we have 1 psychosocial care. We have about this, we have HR Health Zone is a safe house where integrated intervention are lead, and it includes transit rooms for women, children spaces, and administrative office. From 2010 to 2030, approximately 15,000 cases are reported. We have 87% are women and 34% are young, less 18 years old. For medical care, we have health center staff are trained and equipped in the MOH minimum package of activities, including drugs, basic supplies, contraceptive, and post-exposure prophylaxis. And 50% of survivors are referred to the health center by the community core or safe house. Rape and physical trauma represent 94% of cases. About legal care, HR Safe House have a legal clinic and counselor supported by ABA Association American Bar Association to document cases of survivors, to accompany them to police or tribunal, to document, receive the judgments, conduct family and social mediations, follow up all cases, to government services and sensitize community on national and international human rights tools. For the 3 years of implementation, about approximately 9,000 people received legal assistance. About social, economic care, and community reinsertion, we have the strategy of village saving and law association. Association members have money and give out lands for 12 months maximum. The vessel increases the economy and social capital of the community. And Ushindi has already 432 vessels with 2,800 people that have saved nearly 30,000 on 6 months. I want to mention here that the people and the women and the couple on the reproductive are receiving family planning services during that time. On social, economic care, and community reinsertion, we have a literature cycle that teach reading, writing, and arithmetic for management of income generation. And this training integrates life skills as hygiene, SDBV, and the reproductive health and family planning. We have new people completing literature training. Literature circle, already we have 3 community mobilization. We have 108 community that we call in French noyau core community member. They are responsible of SBCC. They are the aim of the community to identify and refer SDGBV problems. And the member in informal providing BCC2 and the community level. About socio-economic care and community reinsertion, we have youth clubs, autonomous mixed gender self-managed clubs of 10 or 10 and from 10 and 20 youth aged at 12 and 15 years. Weekly meetings to share information and experiences on SGBV, life skills, hygiene, HIV, AIDS, reproductive health. We have the school re-entry. Ushindi has supported school re-entry for vulnerable students, and 33% who were rape survivors. We have a small project that I am project manager, Women Leadership Project. Women Leadership in an added project to Ushindi that builds on the project SGBV platform to strengthen the capacity for women's participation in the democratic process and conflict resolution, awareness and use of family planning and child spacing. Women leadership in action. Here we must emphasize that with its echo of love, churches have an important role to play within victimized community to build safe places that provide care, comfort, and hope. Here we are, Pastor Arnold provides information to a police colonel about the Standards Day method. And the colonel will in turn help raise awareness about value and benefits of family planning with her subordinates. We have another story with Seka 20 Church busted a brothel. In Mulongo town, young girls were forcibly prostituted in hut-based brothels by local gangs. But Women leaders inspired the Women Association of the Seka 20 churches, busted the brothel and free the young adolescent girls. After an holistic counseling, the girls were safely reintegrated into the family. Here we have Nadine. That is a good story. Nadine fights forced early marriage. Nadine is 27 years old. Her womanly empowered leadership is just one example of how one woman can make a difference in her community. She educates parents, especially father, to keep girls in school. She helped 18 girls in her village through school this year. He taught teenagers about the consequences of early marriage. She said that thank you for Ushindi and women for coming at the right time to wake up about women leadership. Project Ushindi final task. Noyo SGBV community member report that families demonstrate respect for more shared household management, practice more gender role equality, and have noticeable reduced physical violence and denial of resource. Women and youth group have raised community awareness to decrease SGBV stigmatization, increase social reintegration of survivors, and improved active listening by children of their parents. At Project Midpoint, Ushindi partners and field agents have achieved 9% of target during the last reporting period and achieved 52% of the life of project targets. Yes, thank you for your attention.
Great, thank you. Thanks, everyone. We really would, is this on? Would love to.
This one's working. Ooh. Yeah, so I was right. Hey, these are three incredibly dynamic women, and there's hope for this very huge challenge to address it. So we'd like to hear from you. We'll pass mics around. We'd love to hear your questions, comments, and engage our speakers. Yeah.
Thank you very much. My name is Rose Ngoma from Christian Health Association of Malawi. First and foremost, I would like to commend the three ladies for the wonderful presentation to unearth issues that do happen in our societies. And secondly, I just want to make a general observation. As you can see, we're talking about sexual and gender-based violence. Who are the presenters? Who are the presenters? Where are the men? I'm quite concerned. Of course, women are quite outspoken. They would want to present these issues. They would want to give the side of their stories. But then, as long as the men will be invisible, we're not going to win the battle. As long as the men are not visible in these matters, we're not going to win the battle. And I want to underline that. Gender-based violence has two faces to it. One, there is a victim, and on the other side, there's a perpetrator of the violence. Now, we've talked quite a lot about gender-based violence, and the men have always been seen as the causes of the problem. And there's been an issue about blaming our men as contributing to this. But then if you look at the family, the women are responsible, in most of our cultures, they are responsible for bringing up children. I'm a mother. I spend a lot of time with my children. Whatever I teach my children has got a bearing on the future behaviors of my children. The men spend less time with their children, especially in the communities where I come from. And therefore, as long as the men are not going to be involved to take responsibility so that they can teach their boy children to respect the girl child and also to love the girl child or the girl sibling in the house, then this issue of sexual and gender-based violence is not going to be addressed. And secondly, if you look at the faith-based community, the churches, you find that by nature of the way things were done, the churches are led by men largely, and you find the pastor is a man, and the elders are men. The women, yes, they have their women's guild and so forth. Now, when it comes to addressing such issues, it's not a man's problem, it's a woman's problem, and therefore I'm not ready to address women's issues. I hope you're hearing that, you get my point. Now, we need to turn that, we need to change it so that the men should be seen to be taking a proactive role and engaging the other men in addressing these issues. I think if you look at it biblically, Adam was given a responsibility. He was told what not to eat, and he abdicated his duties, and he wasn't very responsible enough. That's why Eve was tempted and couldn't fight back and couldn't tell the devil or what not to do. He said, oh yes, we were told. Now, why can't we turn that? Men, why can't we empower them? Why can't we engage them? Why can't we take them to be on the forefront so that we hear their voice? Do they see this issue as a problem? If they do, what is it that they can do as men to be advocates, to be champions? There is a wonderful program in South Africa, I can't remember the province, but it's also dealing with gender-based violence. What they've done in that community is that the men have gone out to be buddies, and they're encouraging each other to address gender-based violence. And they are trying to make sure that they target those people that are perpetrators of gender-based violence, educating them how to respect the women, how to treat the women fairly. And in so doing, that has contributed positively to the reduction of gender-based violence in that community. And I believe that in the church, we can also do the same. We need to get our men on board, and we need to see men being champions. Of course, we're not saying that when you become champions, that means we'll lag behind. We'll work with you so that collectively we can solve these problems together. Thank you.
Thank you so much. Any of you would like to comment on that?
Yeah, so your point is definitely well taken. Thank you. That was very eloquently stated. But I just wanted to add that there are 3 programs that we can highlight where this is being done. We need to scale it up significantly. But Sonke Gender Justice is a program in South Africa, actually, and it's a program, it's run by men, and it's really men taking an active role in addressing these issues, doing trainings and that kind of thing. Men Can Stop Rape is another initiative, and Men as Partners is another initiative. So those are just 3 I know off the top of my head, but again, they need to be scaled up significantly, but they're models to replicate and scale up, but thank you.
Any other comments or questions? Oh, thank you, Michelle.
I think everybody can hear me without my no. Oh, sorry. Just to add to your point, I completely agree with you, and I would also say that actually I think we have to change the dynamic even between men and women, and it needs to be a community issue. And what we've seen from actually some good evaluations, programs like Tostan, which are fighting female genital cutting, the way that they've been successful is really by engaging men and women together in a community. And the same with another excellent program called Raising Voices in Uganda that is doing something very, very similar. And what you do find is that economics drive a lot of things. I just want to put a note of caution. When we were in PEPFAR and we were dealing with this issue, we decided that engaging men was a huge priority, and we looked at investments of resources over time, and what we found was it was really stunning how quickly every one of our programs ended up investing the vast majority of their resources related to gender and gender-based violence on working with men and boys. And part of it is because, in all honesty, you can go into any community and you can call all the men and boys together, and before you know it, you have a square full of people who are all willing to talk and express their opinions and really kind of engage with you. They're easy to reach. But if your target is a 13 or a 14-year-old girl, it's very, very difficult to reach those girls. And in fact, one of the things we've seen from our research is that is really fascinating, is that when you look at what happens to boys when they enter their tweens, kind of this 10, 11, 12-year-old ages, is that their social networks increase dramatically and their ability to move increases dramatically. But with girls, their social networks are really reduced and their ability to move around is really reduced. So while I completely agree, I think we also have to focus on community, and we have to recognize that in every community there are those who are more vulnerable and you have less access to, and you have to really think about how you're going to get them.
Great, thank you, Michele. We have time for one more question. Yeah, Douglas, do you need a mic? Yeah. Good.
Thank you very much. These are great presentations and a lot of food for thought. Knowing that in the international community, the effectiveness and results often require fairly hard data showing it's made a difference. And while I've heard a lot of things that are frankly inspiring me that can make a difference, where would you say is the best place to put resources that and the evidence that shows that it's actually made a reduction in gender-based violence?
Okay, so it's there's not one answer, okay, but there are multiple answers, and part of the reason why there's not one answer is because it's a multi-sector response. So, for example, we know that there are at least 3 things that have proven to be effective in working with schools and teachers. One is to teach teachers, and there are curricula out there to do this, about what are appropriate forms of discipline. And it really helps if you have a Ministry of Education that's willing to actually deal with the whole issue of corporal punishment in the schools. We've also found that if you have a female parent helper in the schools, that it is much like it's a deterrent to this sex for grades issue. Anyway, so there are a list of things that work in the school. We know that if you train police and you set up gender-friendly police forces, and they have special places that are targeted for women and children, and ditto for the justice sector, that you do better. I mean, we could go, I mean, there's a whole list of things, and there are a couple of resources that I could direct you to, actually, probably, instead of going through them. Yes, absolutely. And some of these community mobilization things, there's actually a randomized control trial out now with this Raising Voices project in Uganda that is really showing changes in social norms. And we also have some very exciting things. South Africa has really interesting programs with Stepping Stones, which started as an HIV prevention program. And then there's some interesting stuff coming out of the London School on economic incentives for women.
Yeah, thanks.
Sorry, there's a lot of evidence.
Yeah. Did you want to comment, Jacqui? Okay, good. Yeah, well, I think we are out of time if we want to stay right on schedule. Is that right? Mona, do you have a few words? But I think I'd like to thank again our amazing trio here.